Whitford. Philippa Whitford.
Thank you very much, Mr. Speaker. Like all MPs, I would like to pay tribute to health and care staff across the UK. But particularly in view of the key role of care workers, will the Secretary of State undertake to ensure they are paid at least the real living wage in recognition of their contribution, as has been the case for some years in Scotland? Like everyone, I welcome the stabilisation of COVID cases, but does he accept that the testing and contact tracing must actually be in place before any easing of the lockdown to avoid resurgence and a second peak? So will he achieve 100,000 tests a day by next week? If not, when? And how accurate are the tests in light of the report of a 25% false negative rate? Now, I know the Secretary of State is a fan of phone apps, so I'm glad to hear him recognise the need to increase public health staff to both conduct and coordinate contact tracing. So will he reverse the 20% cut in public health funding in England since 2015 to ensure that they can be recruited now? Finally, when I raised the issue of asymptomatic spread on the 11th of March, he claimed it was rare, but it's actually about 50%. So how is he taking that into account in his COVID strategy?
Secretary of State.
Thank you very much, Mr. Speaker. The Honourable Lady asked a number of questions. Firstly, on the living wage, absolutely all health and social care staff in the UK are paid the living wage because that is the law. I'm very proud that we introduced the living wage and that has led to a significant rise in the pay of, especially of people in social care who were on the minimum wage previously. She asks about asymptomatic transmission. The scientific evidence on asymptomatic transmission does show that asymptomatic transmission occurs. That is one of the very significant challenges that this virus presents. She also asked about test, track and trace. I absolutely agree that test, track and trace is a critical part of keeping the spread of this virus low. It is more effective the lower the incidence, the lower the number of new cases are, the more effective test, track and trace is. And we are therefore building now the capacity for that very large-scale contact tracing that is necessary to go alongside the large-scale testing. The 100,000, as I said,